Hello, my name is Philip Salu, and today I'm presenting a poster titled Use of Pancreatic Tumor Organoids to Identify Personalized Therapies. The purpose of this research was to develop human organoids and patient-derived xenografts from pancreatic ductal adenocarcinoma tumors. So we here at NDSU have a collaboration with Sanford Health Fargo, where we collect resected patient tissues from pancreatic ductal adenocarcinoma. And what we've done so far is to characterize these models, these two models, patient-derived xenografts and organoid models, using RNA-seq, immunohistochemical staining, and certain chemotherapeutic testing. For the purposes of this poster, I am not showing RNA-seq results. Um, just immunohistochemistry and the therapeutic tests. So we have seen um, how our PDX models maintain the PDAC markers that are associated with the tumors that we receive from the patients. In my figure one, I show the staining profile, and we see CK19 PDX1 and SOX9 expression is actually even higher in the PDX models compared to the tumor, which tells us that the PDX models are becoming even more aggressive as, as we continue to grow them. In figure two, I show organoids that are growing in matrigel in 3D. And when these organoids are growing, they grow as hollow cells. So if you take a cross section of them, you end up with what we see in figure three, where we see the duct-like features that are also associated with pancreatic ductal adenocarcinoma. So we see the duct that are formed by the PDAC, by the organoids. We also did some immunohistochemistry, CK19PDX1 and SOX9, and we are able to show that these markers are also maintained in our organoid models. So the organoid models are a very good representation of the PDAC tissue. And so what we did next is to do a little bit of testing where we use commonly used chemotherapeutic drugs. And to our surprise, gemcitabine was showed the greatest response. And that was not surprising to us because gemcitabine is the most commonly used chemotherapeutic drug. And so what we can get from this is that if we're able to develop these organoids from patient tissues very quickly, we can inform clinical decisions on how those patients will react when treated with certain drugs. So in conclusion, we have developed organoids, characterized them, we've developed PDX models and characterized them, and we show that these models are able to maintain the same markers that are associated with the original tumor. For our future direction, we want to do a co-culture involving fibroblasts, treat them with the drugs and see how the organoids respond. We also want to carry out a large scale drug profiling of the organoids that we have. At this point, I'd like to acknowledge DaCCoTA for the grant and our NDSU Animal Core facility. Thank you.